Here's a question most men over 50 are too embarrassed to ask. How often should I actually be ejaculating to stay healthy? It might sound awkward, but the answer could reduce your risk of prostate cancer, improve your sleep, boost your mood, and maybe even salvage intimacy in your relationship. Stay with me. You're about to get the straight science. No fluff, no shame. I'm Dr. Fiona, a hormone and men's health specialist. Today, we're diving deep into something that hardly gets discussed: ejaculation frequency after age 50. Why? Because for men over 50, prostate health, hormonal shifts, sleep issues, stress, and intimacy challenges all collide. And ejaculation frequency may be a surprisingly important piece of the puzzle. I'll walk you through what the science says, what we don't know yet, and how to make this fit your life in a balanced, healthy way. Let's start with the biggest headline: prostate cancer. Multiple large-scale studies looked at ejaculation frequency and prostate cancer risk. For example, a long-term study found that men who reported ejaculating 21 or more times per month had a significantly lower risk of developing prostate cancer compared to men who ejaculated only 4 to 7 times per month. Another review explains how frequent ejaculation may influence gene expression in prostate tissue, reduce harmful fluid buildup, and lessen sympathetic nervous system overactivation. To put it in simpler terms, regular ejaculation might help the prostate and harder flush out harmful substances, reduce stagnation, and maintain healthier glandular environment. That said, it's not a guarantee. The evidence is strong but not definitive, especially for advanced prostate cancers. Now, let's broaden this beyond the prostate. Ejaculation impacts hormones, mood, stress, and sleep, all of which are critical after age 50. Here's how. Ejaculation triggers release of hormones like oxytocin, dopamine, and prolactin, chemicals tied to feeling good, relaxing, bonding. It helps reduce levels of typical stress hormones like cortisol and can calm the sympathetic nervous system. That leads to better sleep, better emotional regulation, less rumination. If you're a man over 50 who's struggling with poor sleep, higher anxiety, or low mood, the sexual and emotional connection side of things matters just as much as the physical. In short, frequent ejaculation isn't just a fun extra. It may be part of your overall health regimen. But again, we're talking healthy frequency and healthy context, not obsession or dysfunction. Next, testosterone, libido, and aging. After 50, many men experience falling testosterone, weaker erections, longer recovery times, and shifts in sexual response. Here's what to know. If sexual activity, including ejaculation, drops too low, there can be physical consequences like reduced penile blood flow, potential for prostate congestion, and a dampening of libido. Maintaining a reasonably regular sexual rhythm helps keep the tissues active, blood flow optimal, and hormonal feedback loops engaged. Importantly, this isn't about high-volume sex or compulsive behavior. It's about consistent, comfortable, sex-positive activity, partnered or solo. If you're over 50 and you're noticing low drive, longer refractory times, or you're avoiding sex entirely, then it might be time to incorporate healthy sexual frequency into your life plan. Let's talk about the emotional and relational side, because it matters. Regular partnered sex and intimacy in general strengthens relationships, builds emotional bonding, and reduces stress. It also has mental health benefits: fewer depressive symptoms, better self-image, improved mood. For men over 50, maintaining intimacy isn't just about sex. It's about connectedness, touch, feeling desired. And that in turn may support everything, from hormonal health to immune resilience to longevity. So, yes, the frequency of ejaculation has physical impacts, but the context of connection, pleasure, meaning is equally important. Okay, now the big question. How often should men over 50 ejaculate? Here's the balanced, realistic, science-based answer. Based on large prospective studies, men who ejaculated roughly 21 or more times per month, which is roughly 5 times per week, had a lower risk of prostate cancer compared with those who ejaculated 4 to 7 times per month. Remember, that's a broad population-level statistic, not a prescription for every man. Also, the benefit was most clearly seen for low-risk, organ-confined prostate cancers, not necessarily the most aggressive types. For men over 50, a reasonable target might be 2 to 4 ejaculations per week, approximately 8 to 16 per month, as a practical, achievable frequency, especially if partnered sex, health conditions, libido changes, or medications make 5+ times a week unrealistic. The key is consistency, comfort, pleasure, and absence of negative symptoms, like pain, forced performance, sexual anxiety. If you have prostate enlargement, BPH, heart disease, medications that affect libido or erection, it's wise to discuss with your physician what frequency is optimal for you. Equally, if your sex life is non-existent because of low drive, relationship issues, or health problems, this topic may be a flag to examine your broader health, hormones, emotional connection, and lifestyle. So let's wrap up. Frequent ejaculation appears linked to a lower risk of prostate cancer, better hormone balance, improved mood, stronger relationships, and better sleep. For men over 50, aiming for 2 to 4 times per week is a reasonable benchmark. But the right number for you depends on your health, libido, partner status, medications, and comfort level. This isn't about pressure or performance anxiety. It's about healthy rhythm, pleasure, connection, and well-being. If you're over 50 and one or more of the following apply: low libido, erectile issues, poor sleep, prostate problems, relationship stress, then your ejaculation frequency and overall sexual health may be a meaningful piece of the conversation with your doctor.